Hello, everyone. Dr. Siddiqui here. Today, I'm joined by Dr. Malik.
Hi, thanks for
Hi,
having me.
welcome. It's a pleasure. So before we get started, can you share an interesting story or experience with us?
So, in urology, there's a lot of interesting stories, right? I mean, we take care of genitalia and there's all sorts of emergencies and things. But I think the craziest thing that ever happened to me was when I was a junior resident, and during the holidays, we try to kind of have a skeleton crew so people can have more time off. So like we had 5 days on and 5 days off, so that one of us would get Christmas, one of us would get New Year's. And so the day before my co-resident was supposed to come back from vacation, I get a call from his girlfriend. So my co-resident is currently being detained by the TSA because he had something, that they were concerned was a weapon in his bag, but it was a tour. It was like a little tchotchke, like a gift, right? And so it's like, okay, it's probably no big deal. So he's not going to be there tomorrow. I was like, all right, fine, whatever. And then later we find out that he actually wasn't just detained. He actually had to go and spend a night in confinement because they thought that this little tourist toy was actually a weapon, and they kept him overnight. And it was this huge dilemma. And it's just, these are the kind of crazy things that happen. Like, life still happens during residency and you still have to deal with it. But it was pretty crazy. So, I mean, he's fine. Everything went great. He's totally great. He's a wonderful urologist, good person. But yeah, it was interesting.
That's crazy. All right. Well, thank you for sharing that experience with us. So let's get started. Can you tell us a little bit about yourself? Who are you? And, you mentioned you're a urologist, so tell us where in the process you're at.
Yeah, so I'm a urologist who is subspecialty trained in female pelvic medicine and reconstructive surgery. So it's a fancy title to say that we deal with basically any sort of pelvic floor reconstruction. So for vaginal prolapse, urinary incontinence, we also deal with things like neurogenic bladder. So patients who have multiple sclerosis, Parkinson's disease, spinal cord injury, we manage their urologic problems or their bladder problems. And I also do some male reconstruction and urinary diversion. So kind of a lot of different stuff. But basically, I am in my first year as an attending. So I did medical school in New York at NYU, followed by a 6-year residency at University of Chicago. And it was 6 years because we had one research year. So typically urology is 5 years. And then I did a fellowship for 2 years in female pelvic medicine and reconstructive surgery at UT Southwestern in Dallas. And now I'm in Baltimore, Maryland, working at the University of Maryland, doing academics and teaching residents and taking care of patients there.
That's incredible. You've spent the last 12 years of your life in training. So tell us, why urology?
Yeah, so, urology was not on my radar at all. In fact, I thought I was going to go into medicine and do cardiology, just like every other brown person. But basically, I did my surgery rotation. I loved it. And then I decided to kind of check out the subspecialties in surgery. I saw ENT, I hung out with urology, I hung out with ophthalmology. I couldn't deal with eyes at all. And so it's kind of between ENT and urology. And I met with both chairmen, and, I met with the residents, and I really felt like urology were like my people. And I kind of liked the variety that's available to us in urology. So you can do minimally invasive procedures, you can do office-based procedures, you can do huge open surgeries for cancer, you can do robotic surgery. And so it just was really exciting to be part of a field that has so much diversity. And I think a big part of deciding what you want to do is like finding your people, finding your tribe. And when I met urology residents and urology faculty, I was like, these are definitely my people. So it was a there's not a lot to go on when you're a medical student, but I think you kind of have to go with your gut a little bit and hope for the best. And so that's kind of what you do, and you do your sub-Is and your rotations, and you figure out if you like it or not. And don't be afraid to change your mind if you don't like it, but luckily I did, and I'm very, very happy with my choice.
So can you tell us what was the biggest challenge, or if any challenges that you've had, going in medicine, being a female in medicine and picking, the specialty and then subspecialty?
Yeah, so I think there's definitely a lot of imposter syndrome, at least for me there was, and I think a lot of people deal with it, that, you think that you're a certain type of person, maybe you're not capable of this or capable of that, or who do I think I am, trying to do something like that. And it's really just all in our head, right? You can do anything you want to, and you can put your mind to it and get it done. And I think that some of that was growing up, like, my parents my mom was a nurse, but nobody was in the medical field when I got to medical school. So it's kind of like learning on your own how to get into medical school, how to do all that stuff, what classes to take, how to study, and having very little, mentorship or oversight. And then when you're in the shoes of medical school, kind of then learning to ask for help and to, work and to, look at what your areas are of weakness and how you can improve them. So I think that was one thing. And then two, I was really worried, like, oh, I can't be a surgeon. I'm very, I'm not that coordinated. And my husband, gave me this little story, and he said, my cousin is a spine surgeon. He was super clumsy, and if he can do it, so can you. And, it was really kind of a small little thing, but I think that he said it, and I was like, well, you're right. It's training for a reason. So you can really, the whole purpose of the path that we take is to get trained at the end of it. And so as long as you are constantly doing the best you can, asking for help, asking for feedback, and being kind of a little bit forward with, making sure that you're getting what you need, then you will excel. And I think that you just have to believe in yourself and not let that imposter syndrome get to you.
Absolutely. It's so true. I mean, I feel like I experience that on a daily basis. I'm like, how the hell did I make it through to this point? So it's definitely true. Okay, let's talk about, work-life balance. I mean, you've had such an extensive, long training period. How were you able to get through all of that? How were you able to manage the stress level? I mean, I can't imagine 6 years of residency and another 2 years of fellowship. How did you do it?
So one is so I'll tell you a little bit about, I also have 2 kids, and I was pregnant twice during residency. So it was a lot of work-life balance and learning how to do that. But I think the biggest thing is having good support. And so I got married right before residency, and my husband is also in medicine. And so he understood the demands of the career and supported me the whole way. He grew up in New York and moved with me to Chicago for residency, and he had never left New York. And he, he's like, I'm in it for you. I'm here with you. And so he literally never gave me stress when I was home. Like, he made dinner, he sent me good lunches. Like, he was just super great and helpful in that way, and just being there. And so that was helpful. And then, I think it's adapting and learning along the way. I mean, no one knows how to do work-life balance. You just figure it out. And so now I've come a long way, and I've, adapted some things, but there was definitely some bumps along the way. So I was pregnant during my 3rd year of residency, and fortunately, one of my chiefs was also pregnant. And so there's only 3 girls in the whole program, but we 2 of us are pregnant. And so, like, we kind of were together and helped each other through it. And then, the pregnancy was fine. My chiefs were very supportive because they had wives recently who were pregnant. So it kind of made it a little bit easier. I had a 6-week leave, which was not really that long, but it is what it is. And then I went back to work, and I had my mom come from Buffalo, New York, which is where I'm from, and help me with my son at the time, to help, me and my husband out at home, and stay at home with us for about 9 months, which was super helpful because it just took off so much stress. But there's definitely many nights I missed of bedtimes, and I was in the OR late or things like that, and that is hard, and you kind of have to do it during residency. But now I've really tailored my I know how to kind of make my OR schedule, so I'm done at a reasonable time. And I've talked to my division and said, we really can't have late meetings, or I can't be there because I want to be home for my kids. And I think you have to kind of stand up for yourself and kind of make sure you're balanced in that way, but also I've become very efficient. So I finish all my notes at clinic. I don't bring anything home with me.
Mm-hmm.
When I'm home with my kids, I'm with them. So I'm like on the floor with them, doing puzzles, playing, like running around the park, whatever it is, like I'm with them, I'm cuddling with them, reading them books. And that's like super fulfilling for me. And I think it helps me get through that work-life balance because I know I have this wonderful thing to go home to. So yeah, it's a little bit of like learning to say no to things when they're not going to fit into your life. And then also just making the moments you have count, you know?
Mm-hmm.
I think a lot of us get caught up in the, I don't have time, I don't have time, I don't have time. But if you look at how much time we spend on our phones or doing other stuff, there's plenty of time. You just got to prioritize the things that matter. So.
Absolutely. I think that was beautifully stated. Absolutely. So urology is a very competitive field. And I mean, being in a male dominated, medicine is very male dominated. So let's talk about that. I mean, the challenges, I mean, coming from an immigrant family, being a female, being in not only a very competitive, but an extremely competitive specialty and a subspecialty. How has that been like?
Well, so my mom's a nurse, so she was super supportive. She really, like, nobody was like, oh, you can't be a urologist. I actually didn't get any, slack on that regard. Everybody was pretty supportive. They're like, oh, you're a doctor. That's wonderful. Anything else is icing on the cake. But definitely getting into urology residency is extremely stressful. There's a lot of anxiety, and I see it now with students. There's a lot of competition, but I think you go for it and you hope for the best and you decide, you go all in and you hope for the best and you do your best. You try to like put your best foot forward. You do kind of away rotations and you do research, and there's a lot of things that you can do to kind of improve your odds. But honestly, being a good person and a nice person comes alive in the interview process and can really help you get into urology. But yeah, it was super stressful. And, when we matched, meaning my husband and I called him the first person. I was like, we're moving to Chicago. He's like, oh my God, we're moving to Chicago. It's kind of like this moment. But I think don't let it hold you back. I mean, study really hard for the STEP exams because those matter a lot. A lot of programs have like these cutoffs, right? Like if you have a score below a certain number, they won't look at it. That's rare now. People are trying to look more at the whole application, but it still matters. So I think studying really, really hard for your STEP exams makes a huge difference. And then, don't let it, like, again, that the whole imposter syndrome comes in, right? Oh, it's so competitive, I can't get it. But you just got to try and put yourself out there. And you can't succeed if you don't try. So if you don't ever try at something, you're going to fail. You're going to fail at many things in your life. I mean, there's going to be so many things that you fail at, but if you always stay in your safe zone, you'll never know what you could have achieved.
Absolutely. So is there anything in medicine that you would like to change or see it be changed in the near future?
Well, there's so many things, but I wish that we had more time to spend with our patients. I think it's become more of a business where we have, some requirements to make RVUs or whatever. And I wish we had more time to spend with our patients. And I really try my best to give each and every patient the time they deserve. And I think that that's valuable, but it obviously makes me run late in my clinic. And, I think my patients understand once they get to know me that that's just kind of how I run things. But that's one thing. And two, I really want my big passion in medicine is health literacy. And I think a lot of what we tell patients gets lost. They don't understand. We don't do a great job of telling them because we're just at different education levels and it's hard for us to dumb things down. So I really want to find ways to make things easier for patients to understand, because then compliance will be better, outcomes will be better. I mean, I think that's kind of a big fundamental building block that we need to focus on improving in medicine. So.
Absolutely. Yeah, absolutely. I think that's a huge component of, we try to teach patients, but I think the lack of the time, that the sufficient time amount that we don't have with each patient. So finding other ways to empower the patient so that they can become their own health advocate is a huge thing that we can allow us to focus on prevention rather than treatment. Mm-hmm. So let's talk about some, tips and advice for students who want to follow in your footsteps, who want to go into this really competitive field. What are some things, looking back, that you've done that you would like to convey that to students that would like to follow in your footsteps?
Yeah, so I think one thing a lot of students are hesitant to do is asking for help. So meet with the urology faculty in your program, or if you don't have any urology faculty, reach out to nearby local programs. We're all really approachable people for the most part, and we're more than happy to give advice and help students along the way. And then also getting involved in research is valuable in the application process, so finding mentors in that way. But really, I think those are the two big things I would say, and obviously studying for step one, like I mentioned earlier. And then, just when you do eventually do away rotations, like really making sure you're 100% on, that's like your month-long interview, basically. And so you really need to put your best foot forward all the time and be prepared and know your stuff and just be yourself. Like if you're not genuine, it comes across as very obvious to notice. So be yourself and do your best, and things will go the way they're supposed to. So, and definitely ask for help. Ask. It's really important.
Absolutely. So there's another topic that I wanted to talk to you about is telemedicine. Is there any component of telemedicine that you can incorporate in your field?
Yeah, I have a friend in Houston who's been doing this where, you need to do, listen, what I do, we need to do a physical exam, and for surgery, you want to, they usually want to meet you before you're doing surgery. But I think post-op visits and medication management, there is a role for it. However, depending on what state you're in and what kind of, payment models there are, it hasn't taken on widespread in urology yet. But I definitely think it's going to be the way of the future for a lot of post-op visits and medication management, things like that. And I think it's extremely valuable. I mean, having a way to see patients, but not having to have them find parking, pay for valet, take time off from work. I mean, these are really things that affect their quality of life. And so if we can take those hassles away from them, that's a huge improvement in care for sure.
Absolutely. Is there any other topics or anything else that you wanted to talk to us before we end the video?
Yeah, I mean, I think since I am in a male-dominated field, I would just say, for all the women out there that, when people get afraid of going into a male-dominated field because they're worried about bias or gender discrimination, but I think that that's everywhere. And so don't let that hold you back. I think women in urology and women in general who go into male-dominated fields are extremely supportive of other women. And I know there's this fear, like women are not supportive, but in urology, I found that we all support each other. We're all there for each other. We have a organization like for Society of Women in Urology. And it's just a wonderful group of people. And I think there's, glass ceilings to be broken, but I think we're all doing the best we can to do it. So don't let that hold you back, and go for it if that's what you want.
Absolutely. Well, thank you so much for joining us and giving your valuable time and advice to us. Thank you so much.
Thanks so much for having me.